You're watching Fox 10 Arizona Morning with Ron Hoon, Rick D'Amico, Andrea Robinson, Kristen Anderson, and Corey McCloskey in HD.
Plus, we've got the latest out of Japan, where the nuclear crisis grows. It's such a traumatic event to try and process. Diane Ryan is live with that angle.
That's right. Good morning, everyone. A lot of people in Japan will have a hard time coping with what they've been through and what many are still going through right now. And that type of anxiety is not uncommon. We're going to talk to a doctor coming up.
What are the people going through? Yeah, what the people are going through. You know, the whole nuclear reactor meltdown thing has kind of overshadowed the trauma that people are with their families, and the loss of their homes and the loss of their families and the relief efforts and all that. I mean, it's just terrible.
Absolutely. I mean, many of them, their entire lives were swept away. You know, they have nothing but the clothes on their back and their family members, which of course is the most important, but still they've been through a very traumatic situation.
Many of them are just mentally exhausted, and even more serious than that.
Yeah, Diane Ryan is joining us live to explain what doctors are saying about this entire ordeal.
That's right, guys. We're talking about an anxiety disorder, and it can happen to anyone who has experienced any kind of trauma, and it's called post-traumatic stress disorder. And I talked to a Valley doctor who treats this condition. The images from Japan are just staggering. It's hard to watch or even imagine what these survivors are going through. Many are experiencing post-traumatic stress disorder, PTSD.
The post-traumatic stress disorder happens whenever the body has gone through, the emotional state has gone through some kind of trauma. Seeing something or going through something themselves that's very, very traumatic.
Dr. Donese Worden says that's natural. We need the heart pumping faster, the stress hormones flowing faster, to get away from the danger. That's how we survive. But it's supposed to turn off, and when it doesn't, it's a problem.
You can't function because you're stuck in that I need to run from the bear state, or you've completely turned off into the other state of, well, I'm helpless. It's going to happen. Something's going to happen to me, and there's nothing I can do about it.
There are a lot of ways to treat it. Talking about it is the first step PTSD patients go through.
We've got to get to the root of the problem. We've got to dig that back up, help the body process it, both emotionally and physically, and help that patient get past that stuck point.
It could take days or weeks to recover, but it's not only the survivors in Japan or in war zones that experience PTSD.
Business people have almost that kind of a situation with PTSD of being stuck in this, I need to go, put the gas, put the foot to the gas and go, go, go.
Her advice, take better care of yourself. And if you feel that you can't go on, it may be time to get some help. Yeah, and Andrea, if you have a strong family support system or a social support system, you're probably not likely to get it. And some people never get over it, but the doctors know how to treat them and teach them how to cope with it and live with it.
All right, wow. And I imagine that something like that, if you do deal with it, that, you might be okay immediately, but even months or years after, it may spark up again and cause more problems. Wow. Interesting story. Thanks, Diane.